Hello guys, welcome to today's presentation. So we continue to look at the diseases that affect the gastrointestinal tract or the diarrhea diseases. So in today's presentation, we are going to discuss about cholera. So the rain season is here, and so it is very important that we remind ourselves on how we can prevent ourselves and our children from getting diarrhea diseases such as cholera, typhoid fever, dysentery, and acute gastroenteritis. So for those that have subscribed, I would like to say thank you so much for subscribing. And if you are seeing this presentation for the first time, please go ahead and subscribe to this channel and like and share this lesson. Thank you so much. So if you also want to be seeing more of these lessons, you can do well to subscribe and encourage me so that we continue to be having these interesting lessons. Yes, so thank you so much for coming back. So today we are going to look at cholera as mentioned earlier. So as we can see, cholera affects the gastrointestinal tract and the intestine in particular. So our general objective is that at the end of this lesson, the student should be able to acquire knowledge on malaria and be able to nurse a patient with malaria. Our specific objectives as follows: we should be able to define cholera. We should be able to describe the causative organism of cholera, and you should be able to explain the pathophysiology of cholera. You should be able to state the signs and symptoms of cholera. You should be able to describe the basic management of cholera, the nursing management of cholera, and state the complications of cholera, as well as being able to state the preventive measures of cholera. Now note that because the nursing management is similar for all the diarrhea diseases that we've talked about, we've discussed about, such as typhoid fever, dysentery, and acute gastroenteritis. In this presentation, I have not included the nursing care, the nursing management. So you do well to go to other presentations as we have looked at already for the nursing management. So now let's look at the introduction. So cholera is an acute infectious disease caused by Vibrio cholerae. It is characterized by corpus-like watery-like diarrhea, vomiting, muscle cramps, and severe dehydration. So this picture is showing us a picture of the bacteria. This is how it looks like. So it's like a rod-like in structure, and it has this flagellum which helps it to propel itself along the GIT, the intestines to be particular. So now let's look at the risk factors of having cholera. So the risk factors as follows: poor sanitary conditions. So cholera flourishes in situations where sanitary situations, including safe water, are difficult to maintain. So these places such as the refugee camps, the impoverished, or in developing countries, and in areas affected by war, famine, and natural disasters. So the second point is that reduced or non-existent stomach acid. So this is so because cholera can't survive in acidic environment. So for example, we know that the stomach is acidic. So most of the bacteria, when they enter the stomach, they won't survive. But the few that survive are the ones that are going to cause the infection in the intestines. Then the third point is that household exposure. So this occurs when in the house there is a person who has got Vibrio cholerae. Now, because it's infectious, the cholera can be transmitted to other members of that household. So the fourth risk is that raw or undercooked shellfish. So eating shellfish from waters known to harbor the bacteria greatly increases one's risk of developing cholera. Yeah. So also the fifth point is that type O blood group. So people with the group with type O group are at risk, actually twice risk of having diarrhea for the reasons that having cholera, for the reasons that are not yet known. So those are the risk factors. There are about 5 or 6 of them. So now let's go on to look at the definition of cholera. How can we define cholera? We can define cholera as an acute infectious disease of the intestines which is caused by a gram-negative bacterial root called Vibrio cholerae. It is transmitted through oral fecal route and it is characterized by profuse watery diarrhea, which is like rice watery like in nature, projectile vomiting, and severe dehydration. So notice that we have mentioned the system that it affects, which is the intestines under the GIT. Then we have mentioned how it is transmitted through the oral fecal route, and we have mentioned the causative organism, which is Vibrio cholerae, and we have talked about the signs and symptoms as well. So remember that when you are defining a condition or a diseases, you have to take note that you mention the system that it affects, the cause, the transmission, mode of transmission, and of course we talk about the signs and symptoms. So make sure that you mention those four important points, and when you include them, you are sure that you are able to get the 5 marks that they usually ask for. So now let's look at the causative organism and the transmission. So as we said earlier, we said it is caused by a gram-negative. It is a gram-negative. So Vibrio cholerae is a gram-negative bacteria which is rod-like in shape. As we can see, it's looking like a rod. Then it has got this flagellum which helps it for movement. Then it flourishes or it grows well in alkali media. It grows well in alkali media. That's why we said it cannot survive in acidic conditions of the stomach. But in alkali situations, it really flourishes or it grows. So now let's look at the transmission. So the transmission is through the ingestion of contaminated water or food with the bacteria itself. Then the transmission could be direct or indirectly, e.g. with fecal contaminated hands or utensils or mechanical carriers such as the rice. So now let's go on to look at the pathophysiology. So under the pathophysiology of cholera, when Vibrio cholerae is consumed, let's say through water or any food, when it's consumed, it do not survive the acidic conditions of the human stomach. The few that survive preserve their energy and stored nutrients during their passage through the stomach. And they do that by shutting down most protein production. So let's go back to this slide. So we are saying that when it's consumed through the mouth, maybe in the water or in the food, it will pass through the esophagus. When it comes to the stomach here, because the stomach is acidic, most of it will not survive. Now the few that survive, it preserves or it conserves its energy in itself. So the bacteria itself will preserve the energy, will conserve the energy that it has in itself in the stored nutrients as it's passing along the stomach. So we are saying that it does that by shutting down most protein production. So when the surviving bacteria exit the stomach and reach the small intestines, they start to propel themselves through the thick mucus that lines the small intestines to reach the intestinal wall where they are attached and thrive. So what we are saying is that from the stomach, they move and come to the small intestines. Now, as we know, the walls of the intestines are very thick. So what they'll do is that they'll start propelling themselves with the help of the flagellum, as we saw uh, on the structure that it has a flagellum. So it will use that flagellum to propel itself against the thick walls of the stomach to go further to the walls of the stomach where they will attach and start thriving. So now they've reached the walls of the intestine, they've attached themselves to the walls of the intestines. Now, on reaching the intestinal wall, Vibrio chorale start producing the enterotoxin proteins that gives the infected person a watery diarrhea. So notice that when the bacteria attaches itself to the wall of the intestines, it starts to produce an enterotoxin. So it is this enterotoxin which makes a person to lose a lot of water through diarrhea. Now, how does that happen? So this enterotoxin binds to the receptor on the cells of the lining of the small intestines. Now, when it binds itself to the receptors on the cells of the lining of the stomach, part of the enterotoxin enters the cells of the intestinal wall. Then the toxin increases the activity of the enzyme that regulates the cellular pumping mechanism that controls the movements of water and electrolytes between the intestines and the circulatory system. So what is happening is that, let's go to this slide. So what's happening is that Vibrio chorale has entered into the walls of the intestines. Now it has started to circulate or to produce the enterotoxin. So this toxin, part of this will enter into the cells. So these are the cells. Part of it will enter into the cells and it will now activate or it will disturb the enzyme that regulates the entry of water and electrolytes in this cell. As you can see, we have these cells here, then we have the circulatory system. Now there is these arrows which are showing the movement of nutrients, the electrolytes, the minerals such as potassium, sodium, all those ions. Then there is also water also coming in. So what the enterotoxin does is that it disturbs the enzyme which is responsible to regulate these movements. Notice that there is a specific amount of water and electrolytes which is supposed to enter the cell in order for the cell to function properly. Now, if the movement is not regulated, it will become a problem. So this is where the problem comes in. The enzyme which is supposed to regulate how water and electrolytes are going in and out of the cell into the bloodstream or the circulatory system has been disturbed. So as a result, a massive of water will start moving out of these cells, and also electrolytes, also the salts will start coming out of these cells out into the circulatory system or into the lumen of the intestines. Now we also understand that where the salts are going, water also will do what? Will follow. So now because the electrolytes are coming out of the cells, also massive of water will also be following those electrolytes. As a result, those are the things, are the waters that a person with diarrhea will be losing. So that's what is happening. So the enterotoxin binds to the receptor on the cells of the lining of the small intestine. So this is just what we are talking about. So we said part of the enterotoxin enters the cells of the intestinal wall. So the toxin increases the activity of the enzyme that regulates a cellular pumping mechanism that controls the movements of water and electrolytes between the intestines and the circulatory system or the blood system. So the chloride and sodium ions create a salt water balancing environment in the small intestines with osmosis, which osmosis can pull up to 6 liters of water, up to 6 liters of water per intestinal cells. So in the end, we are seeing that the ions, the sodium, the chloride, because they are coming out of the cells, they are creating an environment where it will cause more osmosis to occur now. So because those salts are coming out, water now, which is in form of osmosis movement, will be pulled out of the cells, amounting to about 6 liters of water being lost in these intestinal cells, and that will create the massive amount of diarrhea that a patient with cholera present with. So that is the pathophysiology of cholera. I hope that it is making sense and that you have understood it. So now let's move on to the signs and symptoms. So the signs and symptoms also occurs in these stages. So in the first stage, which is called the stage of evacuation. So during the stage of evacuation, we see loss of fluids and electrolytes is rapid and very severe, causing severe dehydration and electrolyte imbalance. So as we saw from the pathophysiology, because the enterotoxin has altered the normal function of the enzyme which regulates the movement of water and salts in and out of the cell, because that has been altered, and so it's not actually working properly. The electrolytes, the sodium, the potassium, all the ions are coming out of the cells because there's nothing to regulate their movements. So because they are coming out, massive of water also is following them. As a result, a person is going to lose a lot of these electrolytes and water. As a result, there will be electrolyte imbalance and severe dehydration. So, during the stage of evacuation, loss of fluids and electrolytes is so rapid and severe, causing severe dehydration and electrolyte imbalance. So the patient will develop signs and symptoms of hypovolemic shock. So we know that hypovolemic shock comes about due to the loss of body fluids. So now, because this person is losing a lot of water through diarrhea, including electrolytes, this person will go in a hypovolemic shock. So also we have oliguria. Why do we have oliguria? Because this person is losing a lot of fluids through the GIT. Now the kidneys, they do not even have much water to excrete for urine formation, so there will be reduced urine output. Also, we have seen that because this person is losing a lot of water and electrolytes, it will also affect their blood pressure. So because they are also going into hypovolemic shock, this person will have low blood pressure or hypotension. So because of hypotension, because this person is losing these waters, their heart will start to pump very fast, and this will be evident by a patient having a rapid pulse or tachycardia. And then there will be signs of electrolyte imbalances such as mental confusion or convulsions. So because this person has lost a lot of electrolytes, and we know that for the nerves, for the brain to function properly, they require electrolytes such as potassium and sodium. So if those things are lost, the person will have mental confusion or convulsions will set in. So this will occur in the stage of collapse. So we saw in the first stage of evacuation, the person is losing fluids, is losing electrolytes. So that is during the stage of evacuation. So things are being evacuated, water, electrolytes, all those things are being lost. Now, because of the electrolytes and fluids which are being lost, a person now will move to the second stage, which is the collapse stage. Now, a person has lost a lot of fluids, so now they are going into hypovolemic shock. Their blood pressure is reducing, their pulse is increasing, because the heart now is trying to pump as fast as possible in order to provide much blood which is needed by the body, which is having these problems. And so because there is electrolyte imbalance, this person will go into mental confusion or convulsions. They will start convulsing because they have lost a lot of electrolytes. So that is during the stage of collapse. Now we move on to the stage of recovery. So now the patient, as we know, every disease has got this, the pathogenesis and its lifespan. So when it comes to the stage of recovery, the patients become dehydrated. Yeah. So from the stage of collapse to the stage of recovery, probably at this time we have started managing this patient, and so they have become now hydrated. Their BP is normalizing, it's increasing, it's becoming normal, and their pulse is also becoming normal. So acute painless profuse diarrhea is due to the presence of leaks and the vast number of vibrio Chorale in the stool. So there is also vomiting due to acidosis during this stage. So then there are also leg clamps. So the leg clamps are due to electrolyte imbalances. Then there's restlessness and irritability, which is due to electrolyte imbalance. And also we have sunken eyes due to dehydration. Then we also have dry tongue and mouth due to dehydration. We also have fever due to the presence of the bacteria in the body. Then we have loss of skin turgor due to dehydration, and so we also have increased thirst due to dehydration. So now let's just look at this picture so that we just analyze the signs and symptoms. So as you can see, this person has got sunken eyes, they are looking weak, and this is how the patient with cholera will likely look like. And when it comes to management, this is a type of bed that this patient needs to be nursed on because of the profuse diarrhea, which is watery. So the patient is unable to hold the pressure of the diarrhea, so they have to be nursed on a bed which looks like this one. And of course the intravenous fluids, which are a major part of the management, is connected. So this patient is even receiving IV fluids. Now let's continue now to look at the management. So look at the signs and symptoms. Now we have this patient in an outpatient department or at the clinic. How are we going to manage them? So when it comes to investigations, a dark field microscopic of the stool may show the movement of the vibrio chorale. So microscopic examination of the stool will show the movement or even the visible bacteria itself. So secondly, stool, vomit or rectal swab will be collected for microscopic culture in sensitivity, and so this will show the presence of the vibrio chorale. Also, immunofluorescent, which allows for a rapid diagnosis. So this is where the sample, the stool, is gotten from the patient and tested for a rapid diagnosis. So also blood studies are going to be done. Then also a rapid antigen test, which is equivalent to this one. It's the one which gives a rapid diagnosis. So blood studies includes a full blood count, blood culture. So all those can be done. So when it comes to the treatment, so the aims of treatment or management are as follows. One, we want to collect fluid and electrolyte imbalance. So this is an emergency. So when we have a cholera patient who has just come in and they are having all these signs and symptoms, they are losing water through diarrhea, they're having projectile vomiting, we need to act very fast. We need to establish or cannulate the patient so that they are able to receive the fluids very fast. So it is an emergency, so we have to do the resuscitative measures. So the first point is that we want to correct the fluid and electrolyte imbalance. And then we want to eliminate the causative organism, and this is going to be done by use of antibiotics because it is a bacteria. Then we also want to prevent the spread of the infection. So because cholera is infectious, we don't want it to spread everywhere. As we saw even in the risk factors, we said living with a patient or a person with cholera can put at risk of everyone in the house having that cholera. So we want to make sure that we isolate this patient, manage them accordingly, and prevent the spread of the infection. Then we also, so those are the aims of management. So when it comes to intravenous fluids, they are going to be administered as follows. For adults, we are going to give 100 ml per kg body weight in the first 3 hours. Then we are going to give 70 ml per kg body weight in the next 2 to 3 hours. So in children less than 1 year, we are going to give 100 ml per kg body weight in 6 hours. So that's for the intravenous fluids, which are Linger's lactate or normal saline or 5% dextrose. So also we are going to give oral dehydration solution at 50 ml per kg body weight in the first 1 hour. So we also want to add electrolytes such as potassium and chloride, which the patient is losing. So we are going to add these electrolytes also. So when it comes to antibiotics which can be given tetracycline for adults, doses can give 250 mg to 500 mg IV or orally QID for 5 to 7 days. So Septrin, because it's an antibiotic, can also be given at such doses. Then other antibiotics can also be given, such as cefotriaxone, ciprofloxacin, flagyl. They can also be administered. And also we want to give zinc supplements. So zinc tablets are going to be administered as well. This is so because zinc may decrease diarrhea and shorten how long the disease has taken in children. So zinc supplements are also going to be given. So that is the nursing, the medical management. So for the nursing management, please go to the other presentation on acute diarrheal diseases or typhoid fever or dysentery. You should be able to find the nursing care. That is the care that we are also going to implement in this management of a patient with cholera, with major emphasis on the fluid replacement and management, and strict isolation, which are also in those presentations. So make sure that you check them out. So now let's look at the complications of cholera. So hypoglycemia will come about due to the patient, because they are so ill that they are not even eating. So they will have reduced glucose levels, and these glucose levels can lead to a patient having seizures, and becoming unconscious, or it can even cause death. So this also reminds us during that the management we are supposed to give some dextrose. So you can give some 5% dextrose or 50% dextrose infused in whichever fluid that we are giving, so that we prevent hypovolemia, we prevent hypoglycemia, which could lead to death. Then the second point is that the second complication is low potassium level, low potassium levels. So this is due to loss of large quantities of minerals, including potassium levels, which interfere with the heart and nerve functioning. So we saw during the pathophysiology that this person is start losing a lot of electrolytes such as potassium, sodium, chloride. So with all these electrolytes are being lost, this person is at high risk of suffering from reduced amount of these electrolytes, including potassium. And if the person loses a lot of these electrolytes, we see that the functioning of the heart and the nerves is going to be disturbed as well. Then the third complication is that of kidney failure. So because this person has lost a lot of fluids, they are dehydrated, the kidneys won't have any blood, enough blood to filter any water, to filter in order for it to function. As a result, a patient may go into kidney failure. So those are the major complications of cholera. So now let's look at the preventive measures. So how can we prevent cholera? The first point is that we should wash our hands with soap and water frequently. We should drink safe water every day. We should eat foods which are completely cooked and which are hot. So make sure that this rain season we avoid eating cold foods or foods which are not completely cooked. Then we should stick to fruits that can be washed. Stick to fruits and vegetables that can be peeled. For example, bananas, because we are not eating even the cover, the outer part of the fruit, we are able to peel it in order for us to eat the inside part. So those are the kinds of fruits that we should stick to this rain season. Then also in the United States, there's cholera vaccine called Vaxcola. So this is available in the States. So for those people who are coming from the States and they are visiting endemic areas with cholera, or they are going to areas which have got cholera, which are endemic to cholera, they are able to get this vaccine. And so this is where today's presentation ends, and these are the references. So we got the information from the www.cdc.com, Mayo Clinic, and the World Health Organization. Thank you so much for listening, and wish you the very, very best in your exams as you prepare for them. Remember to subscribe, like, and share this video.